Hi, I'm Dr. Cecilia DiMartino. I'm a naturopathic doctor in Waterloo, Ontario at Willow Wellness Clinic. This is a 6-part video series on being pregnant and having a baby. This is the part 6 of 6, and in this video I'm talking about my favorite products. So these are the things that you want to throw on your baby shower list, or just things to get that can be very helpful. So I'm just gonna talk about some of these. So if you are going to give your baby a soother, so if that is something that you want to do, or if your baby just is able to take a soother, because some babies don't, then the one that I would recommend is a natural rubber soother. So there are a couple of brands out there. Nature Soother is one of them. I forget the other one, but if you just Google natural rubber soother, that way it's natural, meaning that if the baby chews on it or does whatever, it's totally harmless. And so I would recommend that. You would have to probably change the soother a little bit more often than the synthetic ones, but definitely more natural. Another thing that I found really helpful, this is more when the baby started to eat solids, is a hard shell bib. So one of those bibs that comes down and has a bit of that curvature to kind of catch everything. Baby Bjorn is one of the brands that I know makes one. I find it to be very, very helpful. Again, a little bit when they're a little bit older, but very helpful. When they're young and just born, they're going to be drooling a lot. And so having those cloth bibs, those soft bibs, have a ton of those on hand. I mean, some babies are more droolers than others, but having something there is always helpful, because otherwise what can happen if they are, especially when they're teething, they'll drool more. And then if their clothes are wet, they could end up getting a bit of a rash or and irritate the skin. So having those bibs, and then you can just kind of throw them in the wash as you need them, is a good idea. So having extra is good. Receiving blankets or cloths or anything like that basically to wipe spit down, to if you have overproduction of your milk and you're leaking, like any of these kind of towels to keep on hand, always helpful when you have a baby, especially newborn babies. And breastfeeding. So if you are fortunate enough to be successful at breastfeeding, then and having tops that are really easy. So tops that maybe zip down from the top, that you can just easily just breastfeed without having to remove your whole outfit, can be really handy. So take a look out for those. And by the way, they don't need to necessarily be labeled as breastfeeding tops. I have gone to regular clothing stores and you can find ones with like zippers and stuff like that, which can be, or snaps even, and then you can use those as well. My favorite breastfeeding pillow is the My Breast Friend breastfeeding pillow. Basically, it's a little bit more, it's a foam, but it's a little bit more solid, and I find, that it just holds everything in place a lot better. You clip it around you, so it kind of looks like, what do you call those, floaties or whatever, but it just holds the baby there, so you're not constantly holding that weight all the time, and you can put on your lap, and it's just right there, and then positioning just makes it a lot easier. So I found it to be really helpful. Personally, we actually use glass bottles. So if you're going to pump or use breast formula or whatever to feed your baby, then personally I would recommend glass bottles. If you can invest in those instead of the plastic. Yes, I know most of them, if not all of the plastic ones, will now say BPA free. However, BPA is one single component of a chemical in the plastic that they researched and noticed that it caused harm. There are so many other chemicals in plastics that if you can avoid plastic, the better. So we did use, or do use glass bottles, and so if you can opt for those, I definitely do recommend that. By the way, in Canada and North America, the recommendation, you don't need to sterilize your baby bottles, because we have drinking water and water that is not contaminated. So just dishwasher is fine, just so you know. Natural creams. So any type of skincare product, whether it's for yourself and you're pregnant, but especially when the baby comes, read all of the ingredients. Make sure that you understand what the ingredients are. There's no parabens in them and other chemicals that can, because anything you absorb through the skin will go into the bloodstream. So the two most common, I guess, creams, if you will, for babies are the baby rash cream, the zinc oxide cream. Again, try to opt for a more natural brand and reading the ingredients, because even though it says natural on the cover, doesn't always mean that the back is and the ingredients are natural. So read that. And then calendula is very soothing for any type of diaper rashes and things like that. But again, pure is better. So Veleda, for example, or Weleda with the W, is a brand that has very good quality stuff. But again, still read the ingredients. So we use just calendula oil. And it's just calendula and oil. So that's all. There's no perfumes. There's no other crap in them. And I found that to be really soothing for our daughter. The other thing, and get a mattress protector. So something that will for the crib, because in case you have the baby has an accident or whatever, it doesn't actually seep into your mattress, because I mean, who wants to wash a mattress? So a mattress protector, so something where it's like cotton, ideally organic cotton, on the side where the baby would be touching, and then a little bit more plastic on the underside to prevent it from seeping through. Of course, lots of sheets. If the mattress itself can be organic, even better, bonus. All of these things to think about in terms of contamination. And then lastly, home remedies to keep at home, right? So your baby's having a bit of a cough, it doesn't seem to be serious, maybe a little bit of a fever, also doesn't seem to be serious, anything that obviously doesn't require, medical attention. Keeping home remedies is a good idea. So, for example, so specifically homeopathic remedies. So homeopathic remedies are energetic remedies. These are very natural remedies. The great thing about homeopathic remedies is that you can't really overdose them, and most of them, unless they have honey in them, are good from age 0 to plus, right? So some of the most common brands that you can find these at the health food store, you can find these even at the grocery store in the healthy section. Homeocan, the ones that have kids 0 to 9, that brand is good. Boiron, 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 as well as Orange Naturals, carry homeopathic lines specifically for kids. And it'll say things like for sinusitis, or for cough, for a dry cough, for a wet cough, for nighttime, for fever and pain. Fever and pain, that one I really like a lot if they have like fever because they're teething, or a mild ear infection, or something that doesn't require a lot of intervention. These are great remedies to use. This is what I use at home, and if those are not effective, then I would seek obviously medical care. But as a first line, it's always a good thing to have. And also, when your baby is born, so from 0 to 6 months, they recommend 400 units, international units of vitamin D per day. So you can get the liquid vitamin D for babies, specifically, that are 400 IUs. That's what you want, 1 drop a day. For the first 6 months to a year, you want to have one drop a day for the baby. It's very safe. And then the other thing to introduce right at birth are probiotics. So that's because it seeds the good bacteria in the gut. My favorite one is the HMF Baby B from Genestra that you can get at the health food store or through your naturopath. In the fridge section is just a little powder scoop that you give the baby, and it colonizes the digestive system, decreases things like eczema, so allergies, as well as colic, and just for better digestive health, in general. So doing that from day 1 is in my opinion a good idea. And then once you've introduced foods and you've determined that they don't have a fish allergy, then omega-3s, fish oil, It's very, very good for the development of the brain, good for the heart. It's anti-inflammatory, et cetera, et cetera. So lots of good stuff to take, for the baby. But those are the top three things that I recommend. And then, once they're starting school or daycare rather, and they get colds and flus and that type of thing, then there are other things that, we can add to that. But, talk to your naturopath about that. Kids are really resilient. They don't often need too much, but just a little bit of tweaking, sometimes tweaking the diet makes a big difference in their immune system as well. So hopefully this list of stuff was helpful. If you have any questions, info@willowwellnessclinic.com, and we'd be happy to answer any questions that you have or to comment along with this video is fine as well. So hopefully this was helpful, and we hope to see you soon.